Yes, hi, I'm Dr. Gregory Morris, podiatrist at Queens Medical Center in Honolulu, Hawaii. And I'm here today to talk about plantar fasciitis, by far the most common foot problem we see in the office. So what plantar fasciitis is, it's the same thing as heel pain or heel spurs, and it's a ligament on the bottom of the foot. So it's a big, strong ligament that supports the arch of your foot. It attaches to your heel bone and goes to the front of your foot to all the metatarsal bones. And typically people have pain worse in their heel, that's why we call it heel spurs or heel pain. But any pain from the heel all the way through the arch of the foot is plantar fasciitis. And so I tell patients, basically it's tendonitis at the bottom of the foot. And everybody gets it to some degree from standing, walking, running, being on our feet all day long, especially here in Hawaii, because here in Hawaii we go barefoot a lot. And when you're standing on the hard floors barefoot, it puts a lot of stress on the plantar fascia. So once you've developed plantar fasciitis, it's painful, mostly in the morning when you first get out of bed in the morning, or if you sit for a while, because the plantar fascia tightens up. I said it's a thick, strong band of tissue and becomes tight, especially when you're sitting around because you relax and the muscles contract. So when you first step on, you feel that pain in the morning or after you've been sitting for a while. And after you walk, it warms up a little bit, but every time you walk on it, you're aggravating it. So it'll keep on going on and on and on. So the first step to getting rid of plantar fasciitis is stretching. So we want to stretch our calf muscle. Our calf muscle back here makes the Achilles tendon, which forms the plantar fascia. So the calf's up here, attached to your Achilles tendon, and makes the plantar fascia on the bottom of the foot. And it tightens up. So doing simple calf stretches, especially at home, taking a towel or a belt and stretching, nice and easy, about 10, 15 seconds, stretch. During the daytime, we stretch against the wall. Your typical calf stretches, legs straight, bend your knee, heel on the ground, toes against the wall, stretch, nice and easy. Any stretching you do that stretches out your calf muscle, your Achilles tendon, or your plantar fascia is going to help. The second thing you want to do is do a lot of massaging. So you can massage the bottom of the foot, massage that plantar fascia, but do it gently. Some people get in there and really grind on it, and typically it aggravates the plantar fascia. So you want to do it gently, massaging with a tennis ball or a golf ball or a frozen water bottle, any kind of rolling device that gently massages the plantar fascia. And you can ice it down with that frozen water bottle. You can also soak it in warm water. That also helps. More importantly, it's the calf muscle. Our calf muscle up here needs to be massaged. So massaging it by hand or rolling it or using one of those massage guns and massaging that calf muscle. Oftentimes, if people aren't getting better, I'll send them to physical therapy and they get in there and do some deep tissue massage, some ultrasound, different techniques to loosen up that calf and Achilles tendon and that plantar fascia. The second thing we want to do is wear good footwear. And so especially the best thing for a foot is wearing a pair of running shoes. Doesn't matter if it's Asics or New Balance or Brooks or Hoka. I prefer Hoka these days. This is what I wear for the last 6 or 7 years. Anything that has a lot of support and cushioning. When you look at a shoe, we want a nice supportive shoe that's not too flexible. When you try and bend a shoe or twist a shoe, it's nice and firm across the middle of the foot. That will support the plantar fascia. And like I said, I love Hoka shoes, but every running shoe comes with a cheap little liner inside the shoe that doesn't provide much support. Very flimsy little support here. So at the Ultimate Foot Store or any good running shoe store, you can buy a nice arch support for about $40. It gives you good support, much more thick and supportive than the cheap little liner comes in your shoe. And by wearing a little support like this, it helps support that plantar fascia. Once again, the plantar fascia is just a strong band of tissue. The more you support it with an arch support, with a good solid shoe, and then also we have too, is we have a little plantar fasciitis sleeve. It is like a little compression sleeve that further supports the plantar fascia. So any way you can support the plantar fascia, it's going to help. Now let's tell people, especially here in Hawaii, around the house, do not go barefoot until the plantar fasciitis pain is gone. So in the house, buying a nice pair of slippers or sandals, something like this. Something gives you a little cushioning, a little support, a little arch support. Even a small little heel or wedge helps. It's going flat or barefoot that puts a lot of strain along the plantar fascia. So the more you support it, shoes, sandals, slippers, especially in the house, wearing a good supportive walking shoe, putting an arch support inside the shoe, and maybe trying a little plantar fasciitis sleeve, all those things do a good job of helping supporting that plantar fascia so it doesn't have to work so hard. And then the last thing is if it's painful, taking some kind of anti-inflammatory, Motrin, Advil, ibuprofen, Aleve. Not forever, but for a few days or for a week to help calm the inflammation down. And most people get better doing that by stretching, massaging, wearing good shoes, support, not going barefoot, and taking anti-inflammatory medication. If patients are not getting better, then we oftentimes give a cortisone injection, which helps calm down the inflammation, or we send people to physical therapy to do deep tissue massage, An ultrasound. Sometimes we make people a splint they wear at nighttime to help stretch them out. We also sell those at the store, at the Ultimate Foot Store, sell night splints. And in rare cases, probably 1% of people go on to surgery, or simply I make a small cut and stretch out the plantar fascia. But 99% of the time, plantar fasciitis, heel pain, heel spurs goes away with conservative treatment. Thank you.